I'm John McCullough from PositiveLight.com, and we're here in Toronto at Katie's forum, National Forum, New Sciences and New Directions in HIV and Hepatitis C. And the theme of the forum is the integration of research into practice and the integrations of systems and programs to better meet the needs of clients. And I'm very pleased today to be here with Darwin Fisher, who manages Insight in Vancouver. So, Darwin, maybe you can tell us a little bit about Insight.
Absolutely. Insight is a clinic in downtown, in a very poor area of Vancouver, which is on the other side of the country in Canada. And this small area called the Downtown East Side is home to an estimated 3,000 to 5,000 intravenous drug users. The area has historically been a low-income area for about the last 70 years, and what's happened over that 70 years is the housing stock has become decrepit. We've lost so much housing. We had a crisis of homelessness that really became an avalanche in the late 1980s, and the area became home to a very traumatized population. Many of those people struggling with addiction in the area come from backgrounds of serious trauma and abuse, and addiction really took off in the area starting at around 1990, and what we saw coming out of that were rising rates of overdose deaths going from 38 province-wide in 1988 up to 413 9 years later. Around that time, researchers were also discovering that that area had the highest seroconversion rate in the Western world for HIV, and hepatitis C amongst the drug-using population was at saturation levels. Yes, if you can get it, you have it. The whole community and outlying communities banded together to come up with an innovative response to this. And this was based on a European model, which is the supervised injection site. Because injection drug use was epidemic in this area, it became crucial to connect those users with healthcare. And supervised injection sites are a brilliant strategy for this. So what happens is users in the area, or any drug users in Vancouver, will purchase their drugs elsewhere, and they can come in and use them under nursing supervision at Insight. And the Insight staff is composed of nurses, non-clinical staff like me, and peer staff from the community. And they're all working at the same level. And the goal is to lateralize that communication, not top-down communication, but to welcome people into healthcare, give them access to things like running water, nursing wound treatment. The goal, the four goals of the site are to prevent overdose deaths, reduce the spread of bloodborne virus, build connections with some incredibly marginalized people who are stuck in the alleys and in the doorways. And then once you build that trust, try and leverage that trust into other services that those folks might need.
Well, that's a real challenge you have there. So I know you were telling us that when you presented earlier at the forum here that the way that you really feel you need to do that is to build community. So maybe you can tell us a bit about what that means, what that looks like. It's
a matter of getting priorities straight. Again, the model often when we want to bring clinical care to people is to start off with the clinical aspects and maybe move towards community, but you really need to start with community and move towards those other goals. How are people in the downtown east side viewing their situation? Well, desperation, trauma, it's an emotional interface. It's not a clinical interface that they're coming at the problem with. So you need to meet that with warmth and humanity, and that means that Insight runs on tolerance and welcoming and giving people a sense of being stakeholders in the operation. Nomenclature, maybe it's important, maybe it's not, but we call the people that use the site participants. And when we intake people into the site, it's important to tell them what the site does, to make sure the site's appropriate for them, and to also say that by using this site with as much tolerance as you can, and by abiding by some Health Canada guidelines, you're actually helping us run your site along with you. And what happens is it's not appointment-based healthcare. People can use the site as often as they need. So you see people day after day after day, and that means that that relationship tends to accrue naturally rather than me having to make it all happen at once. And the most important conversations sometimes that happen at Insight are the conversations that don't have anything to do with healthcare or anything. They're about movies, they're about books, they're about all the other aspects of humanity that get left out of people's lives when they're stuck in the alleys. And that's a starting point, but it's also, I think, healthcare in and of itself to make those moments and to make those safe spaces and to enfranchise people. Because any strategy that doesn't deal with that, that keeps people in those marginalized places, it's just contributing to the status quo that we've got right now for addicted people, which I don't think is very good.
Right. So you've got some specific programs that illustrate that. I know your detox program was one, for example.
And the best referrals that you can make, especially with people who are homeless and are under desperate circumstances, are the quickest and the most direct. So after Insight was open a few years and we realized that most of the people visiting were asking for detox, we put 2 floors of detox directly above the site. And a lot of people think, oh, detox above a safe injection site, it doesn't make sense. It makes beautiful sense because the same folks are working at both places. So you get a chance to continue those relationships. And people are often ambivalent about change and new situations. So when you've got familiar faces and a philosophy that already values you, that goes a long ways towards sort of removing some of those barriers that way. So there's the detox above us, and there's also there's a medical program called CTCT, and that's because there are many people in the community that desperately need intravenous antibiotic therapy due to soft tissue infections that are often starting because they can't access running water and can't clean their hands in their injection site. You end up with an abscess that turns into cellulitis or osteomyelitis or endocarditis. These claim limbs and lives in the area all the time. And what happens is when IDUs go into our hospital system through an ER, they're not warmly received. Generally, that system is not well set up. And often when that person has to get a PICC line installed and stay in the hospital for up to 2 months, they just don't make it for reasons of addiction and because it's not a socially welcoming environment. So the idea of moving almost a ward of the hospital into the community and having a space in the community, CTCT, where people can come and they get actually rather lovely small studio rooms with bathrooms and cooking facilities where they can get their intravenous antibiotic therapy. It's in their neighborhood, the social supports are there, the food supports are there. If I'm homeless and I need IV antibiotic therapy and I go to CTCT, I want to stay there. I want that environment. And I get my antibiotic therapy and I complete it. The retention is in the high 90s, and that's really important. And then once you've got people in situations like that, you can actually leverage them into housing, because I work for Portland, who co-manages these sites along with the local healthcare authority, runs 1,100 units of social housing. So stabilizing people with housing is a real ultimate goal that way, and keeping them connected with the service providers in the community, and maybe getting them involved in peer employment. Work is healthcare. Work provides structure and identity and all kinds of things. So it all works together, but it's based around basic human needs, and IDUs don't have needs that are that different from ours.
So do you think Insight is making a difference as a result of these initiatives?
Well, Insight's been open for 10 years as we speak here in the community, and I think I can speak to a variety of ways that it's made a tremendous difference in the community. On the most basic level, that idea of treating people who are struggling with addiction as people of value is just something that's implicit, non-negotiable, and really fundamentally important to what goes on. And I see that spreading out in the community, even with our relationship with the local police force, which supports Insight's functioning. In fact, we've recently had a couple of deaths in the larger Vancouver community, and the police have gone to the media and encouraged users to use at Insight because it's the only safe facility to use it, and it prevents overdose deaths. So that relationship has changed to the point where police officers are sometimes coming to me and saying, hey, there's a person out in the street, can we talk about getting them into on-site? And I actually talked with 2 officers who were just incredibly angry about the treatment that a person that they tried to bring to hospital from the area had gotten at the hospital. Hearing that is nothing that I would have heard 10 years ago. And there's also plenty of research evidence, very accessible, that overdose deaths have declined by 35% in the local area. And also it's part of a comprehensive effort that has reduced those record high seroconversion levels. It's cut them in half, I think. And that is truly fantastic. And it's also become the admiration of the world, the way that those projects have worked together on that. So yes, I think it's absolutely a success. It also does like over 400 detox admissions a year. So if you think services for drug users promote drug use, I say this: I think it's the trauma and the marginalizations and the garbage in the alleys that promotes drug use. When you get people in front of compassionate care, it promotes wellness, detox, housing, and reduced death and reduced HIV.
Well, this is a really good example of integration in practice. So, Darwin Fisher, thank you so much.
Great seeing you, brother.
Thank you. I'm
Peace.
John McCullough from PositiveLight.com.